Okay. No, thanks everyone. Thank you everyone that has joined us already. And good evening, ladies and gentlemen. It's now 8:30 in the evening in Brazil. It's 9:30 in the morning here in Canberra. And welcome to the Australia-Brazil Alumni Leadership Conference, co-hosted by the Embassy of Australia in Brazil and the Australian National University. It's a pleasure to see some familiar names on our attendee list today. And looks like you've been enjoying it because you were back, so that's very good to see. Before we start, I would like to acknowledge and celebrate the first Australians on whose traditional lands we meet and pay our respects to the elders, past, present, and emerging. A Embaixada da Austrália no Brasil apresenta a série de webinars 2020 em parceria com a Australian National University, a universidade número 1 da Austrália, de acordo com o ranking QS. Essa semana, nós estamos trazendo especialistas renomados mundialmente para apresentações que vão apoiar o seu desenvolvimento profissional. O meu nome é Ana Paula e, como parte da comunidade Alumni do Brasil, vou ser a host deste evento esta noite. It's a pleasure to be the moderator of tonight's session when we are going to discuss a topic that has been on the news every day for the last few months, the response to COVID-19 and Australia's approach to it. I would like to mention a few housekeeping rules for our attendees. This webinar is being recorded and may be broadcasted on ANU TV on YouTube. We encourage everyone's participation. Your cameras and microphones were muted on entry, but there are several ways you can interact with our speakers. If you would like to ask a question and speak with them, please use the raise your hand function on your screen and we can unmute you. We can also enable your video. If you want to interact with our speakers that way, just use the button raise your hand in your Zoom screen. You can also use the Q&A function to post questions. You can just type your questions. Our speakers will be able to access them. They can reply it by speaking to you, or they can just type an answer as well. And if you want to send any comments, feel free to use the chat function. After our panelists today deliver their presentations, we are going to address any questions that may come from the audience. And now I would like to invite Nick Johnson, Director of International Strategy and Partnerships at the Australian National University, to say a few words.
Thank you, Ana Paula. Boa noite, Brazil. Good morning, Canberra. I'm Nick Johnson. I'm the International Director here at the Australian National University. But I also had a privilege to serve as Australia's first Education and Science Councillor to Brazil a few years ago. So it's great to work again with the Australian Embassy. And, we have a great relationship with the Embassy and with the alumni community. And this is the 5th year that the Alumni Conference is running. And as I initiated it in 2016, it's great to see it's still alive. This is the first year it's online, so it's a bit of an experiment and a pilot, but it's been growing strongly over the last 5 years and in line with the very growing education relationship between Australia and Brazil. Here at the ANU, we're very keen to deepen and strengthen our relationship with Brazil in research and academic exchange and student exchange. I was actually going to visit Brazil in April, but because of the topic today, I could not do so. So I'm really looking forward to the opportunity to come back over as soon as possible. But back to you, Ana Paula, and I'm really looking forward to this discussion this morning or evening.
Thank you so much, Nick. And this is also the reason why we are meeting virtually this year, correct? The topic that we are going to discuss tonight. From the tyranny of distance to the lucky distant country, Australia's COVID-19 response. To cover that topic, we have with us tonight Professor Mark Kenny and Professor Shirley Leach from the Australian Studies Institute at the Australian National University. If during the presentations you have any questions for our speaker, please use the Q&A function on your screen. We are going to start with Professor Mark Kenny. He came to Australian National University after a fantastic journalistic career culminating 6 years as a chief political correspondent on the Sydney Morning Herald, The Age, Canberra Times. He has covered news from the White House to the Vatican to Kandahar. So have you ever been to Brazil, Professor?
No, unfortunately, I haven't been to Brazil, Ana Paula. It's one of the few places I haven't traveled. Most of the travel I've done, incidentally, has been, I mean, I've obviously done a bit of travel on my own funding, but most of the travel I've done around the world has been as a journalist traveling principally with prime ministers and foreign ministers. So I've been to many capitals and I've been to many countries that perhaps I might not have, gone to as a priority, at least as a tourist. And it's been a truly great experience. And I'm very grateful for all of the places that I've been. But South America never made it onto my list, and I was pretty annoyed when the Prime Minister went there a few years ago, and I wasn't able to go.
Well, I highly recommend it. I'm a bit biased. I was born there. But Mark, when you see something of the scale of COVID-19 affecting so many lives, do you feel like going back to reporting those stories? And would you share with us your views on the Australian response to this crisis?
Yes, thank you, Ana Paula. Just in response to that first question, I guess I always do. I've been out of journalism, out of the active business of being in the Federal Parliamentary Press Gallery for, I suppose it's about 18 months now. And this COVID crisis, of course, is an enormous ongoing story. And the journalist in me is always, I think at least partly there's a part of me that feels a sense of loss or fear of missing out, as it's sometimes known, when I see these big press conferences that are happening and major announcements being made. It's the sheer drama of being close to those stories, of being close to political leaders, the Prime Minister and others when big things are happening, and being one of the first interpreters, I suppose, of those events. It's a great privilege. I mean, some people say that journalism is the first rough cut of history, and that might be a bit grandiose, and some of it's, of course, just plain wrong. Some of the details are wrong, and there are some journalists who are perhaps pushing agendas and the like, but it is nonetheless, as a profession, just an absolutely vital part of any functioning democracy, and to have a competitive, robust press is absolutely critical. And I was very proud to be part of that for so many years at the national level. Let me turn now to Australia's response, because Australia's handling of the COVID crisis has been, I think, recognised around the world as highly successful, because the numbers don't lie, I suppose, and that's the truth of it. By any comparison, we've done very well. When I say by any comparison, I guess there's a very nearby comparison that Professor Leach, who'll speak after me, will also be happy to point to, being of New Zealand heritage herself, and that is New Zealand, which has also done extremely well. In fact, I guess you'd say better than Australia, but both countries, by any other comparison around the world, have been terrific. Now, the secret in Australia's case, I would argue, has been a combination of good policy, but a lot of good luck as well. And part of that luck has been simply, and it's the case for New Zealand as well, being surrounded by the largest moat in the world, as it's been described. I mean, in other words, being an island, and being an island a long way away from the major population centres of the world, has not done Australia any harm in terms of the way it's been able to respond to this crisis, because, I mean, self-evidently, closing off the borders, closing off travel from the rest of the world is an advantage that Australia was a lever Australia was able to pull, and it could have quite significant results quite quickly, provided you didn't have a lot of local infection already raging. I mean, there's a point that after which you do it and it wouldn't make much difference, but luckily we got away with that. And it's interesting to note, just on that two of the premiers, most of the people watching this will know Australia is a federation. It has 6 states and 2 territories. So there's the federal government, and then there are the second tier, or the state governments. two of the premiers who are riding very high in popularity at the moment are Tasmania, which is itself an island state to the south of mainland Australia, and Western Australia. Both of those premiers, one from each side of politics, are sitting on approval ratings at the moment, according to recent polls, of 93%. I mean, that is unheard of in Australian politics, really. And that is in terms of their management of the crisis, the COVID threat, and the public response to the various decisions they've taken to keep their populations safe. And I'd say that in a way, that's also a reflection of the moat syndrome, which is that Tasmania, obviously being an island, was able to, there isn't a whole lot of incidental travel between Tasmania and the mainland. I mean, there's obviously a fair bit of tourism normally, and there's a fair bit of commercial traffic. But if you stop those things quite quickly, and Tasmania was able to do that, then you can contain the situation there. It's a relatively small population. And WA, Western Australia, is just so far from the rest of Australia in terms of sheer distance. I mean, it is thousands of kilometres across the desert, really, from the eastern population centres where we are, like in Canberra, close to the eastern seaboard, to the Western Australian state. So both of those states are, in effect, very remote, and that has helped as well. As I say, some of the decisions that Australia has taken through this crisis, as this crisis became evident, were prudent, and some of them were a bit late. But the secret to understanding Australia's performance is, I think, recognising that in some cases, even though they were taken late, or later than they could have been, they haven't, we sort of got away with it. They haven't resulted in an inundation of cases. That said, there's currently an outbreak in Victoria, which is the second most populous state in Australia. It's a very major part of the Australian economy and the Australian population base. And in its capital city of Melbourne, there is currently a series of localised outbreaks, which many people fear is the start of a second wave. Who knows what a second wave looks like? So maybe it is the start of a second wave. It just depends whether it can be contained. And what they're doing at the moment in Melbourne is applying localised lockdowns. This only came into effect. In fact, I think technically it comes into effect from midnight tonight. So this is pretty much breaking news that Melbourne is experiencing this sudden uptick in infections, and they're not reimposing sort of an economic or social lockdown on the whole state, but they are trying to lock down whole suburbs of Melbourne. So there are 5 different local government areas. They're not all joined up together, and together they constitute about 500,000 people. And they are putting checkpoints on the main roads in and out of these places, and police are doing sort of random checks of people to ascertain why they are travelling. That is going to be the way it's done. Now, whether this works or not, I don't know. No one knows, and how the population responds to it is not clear either. But it's an attempt to, and it's not really been done to have this kind of lockdown done in the suburbs of a city. In fact, in Tasmania, which I referred to before, the island state, there were some localised outbreaks at the earlier stages of this, and they used localised lockdowns in that case as well. But it's a bit different because that was not within a major metropolitan city. That was actual small towns and villages and regions in northern Tasmania, and that apparently did work. But there's a lot of concern about what's happening in Melbourne at the moment. The politics, therefore, are pretty tense in Melbourne because, as has been widely accepted, I think this is the case universally, that is all around the world, that it's one thing to impose very strict lockdowns, strict new social distancing rules, bans on travel and the like. It's one thing to do that in the face of a clear and present threat when that is widely accepted to be the case. It's quite another thing, and this was always, I think, recognised by authorities, quite another thing to have to do that again when you have passed the emergency, or you feel you have passed the emergency, and you've got started a process of releasing those lockdowns, and then you get a second wave or you get new spikes in infection, and authorities are faced with that very difficult decision of having to reimpose restrictions, and do so with a population that I think psychologically has changed. And I think there's some evidence in Victoria and in other states around Australia that is the case, that there's this sense of the crisis having, that the real peak of the crisis having passed, and governments are now having to impose difficult social and economic restrictions when people are feeling like they've moved on, they feel like they've done this, and the politics of that are going to be quite interesting, because those huge approval ratings I talked about before, which have attached, maybe not at 93%, but certainly up in the 60 and 70% range for all political leaders in Australia, they may come under some strain as we go through this long period of gently opening up the economy, particularly if we have these kinds of setbacks and there are needs to reimpose lockdowns. One of the interesting things about Australia's response, particularly for those of us who are interested in politics, has been the extent to which the federation itself has, if I can put it sort of somewhat dramatically like this, miraculously suddenly started to work. Australia has really been bedeviled by its federal structure since it came into being in 1901. The states and the Commonwealth have always had tensions between them. There have sort of been jurisdictional arguments. There have been overlaps of responsibility, and the mechanisms for, and they've had different ways of raising money as well, with the Commonwealth essentially having the income tax raising power, and therefore having the vast bulk of money to apportion, and the states having a lot of services to deliver, like education, health, police, public transport, and these kinds of things. Now, until now, there have been various different ways in which that has been handled, but the most recent form since the 1990s has been a thing called the Council of Australian Governments, or COAG has been its acronym. And COAG meetings have happened mostly on a twice-a-year basis. They're normally highly theatrical. They normally involve premiers and coming to Canberra, and they would hold press conferences, and there's sort of a bit of positioning gets done and a lot of grandstanding, and really any change has been incremental. There's often goodwill expressed at the end of these meetings, but unlocking some of these jurisdictional problems, dealing with things like Indigenous disadvantage, or trying to get synchronicity between health systems and education systems and other things, has long been a kind of a fetter on efficiency and as I say, a sort of an arena of friction for Australian governance. Comes COVID, however, and suddenly there's this united front. There's this single emergency, a bit like a war, and we've all heard the war metaphor being invoked all around the world in different ways and for different reasons in respect of COVID. But certainly in Australia, there has been this focus on the state governments and the federal government working together, whether they be of the same or different political stripe. They've all been working together. They've formed this thing called the National Cabinet. Scott Morrison, the Prime Minister, formed that as of mid-March. I think it was March 13. And at that point, really, there has been quite a lot of cooperation between the states and the Commonwealth, a respect by the Commonwealth, that is by Scott Morrison and the federal government, to understand the responsibilities of the individual states. And there has been I think a willingness on the part of all states to work together. So less political point scoring and more problem solving. And this is what, it shouldn't be any great surprise to us, but this is what people want. They want problem solving from their politicians. And the COVID crisis has brought that about in quite a considerable amount. For Scott Morrison, it's been quite an interesting ride as well, because any of you who've watched Australian politics will know that Scott Morrison won an election, federal election in 2019 as a surprise. He came from behind. He'd only just replaced Malcolm Turnbull in a party room coup. Malcolm Turnbull had been voted out, and Scott Morrison had been voted in by his party. Morrison then fought an election sometime later, not very long later, and was not expected to win. He ran pretty much a one-man campaign. Labor was, the Labor opposition was widely tipped to win. All of the opinion polls showed that, and yet in the end, Scott Morrison triumphed. And it became known as Morrison's miracle, because he said so on the night that he believes in miracles. He's a Christian man, and he said he believes in miracles, and everyone talked about this as the miracle win. But what you ended up with, what Australia ended up with, was a government with a new prime minister in its third term, behaving like it was in its first term, and but not really with much of an agenda. It hadn't gone to the election with a big suite of policies. It had gone to the election really arguing why Labor should not be put into power. The voters eventually had sided with Scott Morrison, but here he was now, a new prime minister, not a particularly well known or understood commodity in the political space, and with no real agenda. We then saw the drought getting worse. That culminated in the bushfires, which you will all be well aware of, those catastrophic bushfires that absolutely devastated large parts of Australia and many communities through the Australian summer over Christmas and beyond. And Scott Morrison handled that badly as well. So we had a directionless prime minister who then, in the face of a critical crisis, began to fail. He took a holiday to Hawaii right in the middle of it, didn't tell anyone because they knew that it was sort of controversial. It was only a week-long holiday, but the symbolism of that was really quite terrible. He came back, he was indignant. He took some time to go and visit some of the fire-affected areas because he knew that he was going to be confronted by angry locals. When he eventually did, he was confronted by angry locals. So we had a political kind of descent from a fairly weak position, and that was how the summer went. Now, I say that background because it's important, I think, in terms of what led Scott Morrison to the mentality he brought to COVID, because he had not recovered from in a political sense from his poor handling of the bushfire crisis when COVID came around. And I think he'd had my theory is that he'd had a very sort of close and very real experience of a near political death at that point. He started to understand his own political mortality. And as a result of that, I think went into this COVID crisis knowing that he had to do a lot better. And for Australia, this was a lucky coincidence in a way. We had a prime minister who needed to show national leadership, and we had a crisis that demanded national leadership, so a country that demanded it as well. And I think that led Morrison to a different mindset than we've seen from other leaders in other places around the world, obviously in Brazil, obviously in the United States, certainly in the UK as well, and some other places. There was far less denial in the case of Scott Morrison. There was a much readier embrace of medical expertise, of health officials, of the epidemiology, of the modelling and so forth. And so what we saw was a more front-footed response. Now, as you know, Australia now sits at just 104 fatalities. A good many of them are in the aged care facilities. A number of them also came from cruise ships. In one particular case, the Ruby Princess, which was a pretty big mistake by authorities to allow a cruise ship to unload its, I think it was 2,500 passengers into Sydney, and you know, a vast number of those turned out to be COVID cases. And you know, there were also, because it took some time to close the borders, there were also many coming from the United States. At one stage, it was clear that of Australia's active COVID cases, the majority came from a combination of that Ruby Princess cruise ship and from the United States, even though the virus, as we all know, originated in China. So that's pretty much an overview of it. I mean, the main levers that they pulled that worked here were the closing of the borders. As I say, that came a little bit later in the piece than perhaps it was desirable, but we kind of got away with it. We had closed the border with China quite early, and that was obviously a significant decision. After that came South Korea and then Italy, as the evidence emerged that those countries were experiencing significant problems. And then the other things that really worked, of course, were the closure of schools and the social distancing decisions and the closure of a whole number of businesses. Now, the government made some mistakes all the way through this in terms of both the consistency of what it did and the messaging confusion that led to. But we're talking about around the margins, essentially because of the National Cabinet, because of the division of responsibilities between the Commonwealth and the states, and because many of these decisions in the end were enacted at state level. I think that between the two levels of government, there was a very effective response overall. It is interesting and worth noting that the two of the most controversial things, closing of schools and the closing of state borders, were not matters of the National Cabinet. They were matters taken, decisions taken by the respective state governments. And it is the case that most of the states have restrictions on their borders now, but they're in the process of opening them up. However, not to Victoria, because as I said, we've got that outbreak that's now going on in Victoria, and this is playing havoc with all of that. So Australia is in a very good place, but it's become very clear that there is no, in the absence of a vaccine, there is no way that Australia, a big exporting nation and one of the great travelling nations of the world, I mean, Australians, the 25 million Australians, and in normal times it's said that more than 1 million of them are off abroad travelling. It's a nation that travels a lot. I suppose that's a reflection of its distance, but it's also a reflection of its relative affluence. But none of that's happening at the moment. Of course, the national borders remain closed, and in the absence of a vaccine or a treatment that renders COVID non-fatal, it's likely that, like many other economies, any travel is going to be internal rather than external. I might leave it there and be very happy to take all of your questions, and I'll do that when after Professor Leach speaks.
Thank you, Professor Kenny. And indeed, we already have some questions coming from the audience that will be addressed in a few minutes. But now I would like to hear from Professor Shirley Leach, a professor or fellow at the Australian Studies Institute at the Australian National University, formerly a Pro-Vice Chancellor of Education and Global Education at the ANU and Dean at the ANU College of Business and Economics. Professor Leach has written more than 100 peer-reviewed papers and has been an advisor for government and industry. And with research focus in communication and science, I'm really sure that her input will be very valuable tonight. Good evening, Professor Leach.
Good evening, and hello to everybody. Thank you for that really good overview, Mark. As you can see, in Australia, we have once again found ourselves the lucky country. We have in fact escaped the worst, to this point at least, of COVID as it's rolled around the globe. And I think when we reflect upon the fates of different countries, we can say that we are all in this together, and in the sense that the virus doesn't discriminate. It's happy to infect pretty much anybody. But how each country has been able to deal with the virus itself actually depends upon where we've started from in terms of the strength of our economies and also the makeup of our economies, but also in terms of the ideological climate in our own nations and the cohesiveness of our communities. And what we have seen around the world, for example, I think we've all been watching with great sorrow to see some of the things that have been happening in Brazil, particularly the growing death toll. I mean, that's obviously a terrible, terrible tragedy, and here in Australia, we have been watching that closely. But the country I think that's had the most impact in terms of, I guess, the ideological and communication components of the virus has actually been the US. And you'll see that in Australia, we have in fact copied and followed a lot of the American trends. We have accessed a lot of US social media, but in particular, we've actually seen COVID denialism mimicking climate change denialism in both the US and Australia. But whereas in the US that has seen huge demonstrations and huge pushback against something as simple as wearing a mask in public, here in Australia, because that is much more of a minority trend, we've seen mimicking of the US demonstrations and the, I guess, the fight back against coronavirus in an ideological sense, the attacks on 5G cell towers and so forth. But it's been in a really small phenomenon here, whereas in the US that has been huge. And I think when we look at Brazil, we see again the ideological I guess, discussion there, the climate, the fractures in the society, they've been played out through COVID, just as they would be played out through any, I guess, major issue or crisis that was affecting a nation. Just returning back to the notion of Australia as the lucky country, at the moment, I think in terms of economic well-being, I think we're doing extremely well. Certainly the revised IMF forecast for Australia sees they're only forecasting something like a 4.5% hit to the Australian economy this year. Let's hope that that optimistic forecast holds. But that is in stark contrast to the broader IMF forecast for the rest of the world, which sees something like $17 trillion coming off the global economy in 2020. So as a result of that, we have seen a very strange thing where we've had this incredibly buoyant stock exchange. The ASX has come roaring back. Initially, there was huge fears that Australians were going to be hit in their super because of likely negative returns, but in fact, a lot of superannuation funds, and as you know, here in Australia, all Australian workers have compulsory superannuation schemes on which they're incredibly reliant in their retirement. Those returns have come roaring back, and we should be, I mean, most funds should be pretty much ending on a pretty flat note, which is a very, very optimistic outcome to, if you actually look at the broader global picture. Mark also referenced the travel, and obviously the travel has actually proved to be one of the key containment strategies for COVID-19 here in Australia, as well as across the ditch, as we call it, in New Zealand. We've used our moats to good effect, isolating ourselves from the rest of the world. And in fact, Mark also mentioned that outbreak in Melbourne, which is we're just all watching with horror because it's, each day it seems to get worse. But that has actually come from poor quarantine practices, it seems, although there's an inquiry that will be held into that, in hotels where returning travellers had actually been put in quarantine for 14 days. And it appears that some of the staff who were working in those hotels subsequently infected their families, and it led to broader transmission in the community. So there's now a big rethink of that, and there's the Army have gone in there, or the Defence Forces have gone in, I should say, and we're hoping that that will now be contained. The other thing I think that is worth mentioning, here in Australia, we've had two huge packages, which are part stimulus and part relief for Australian people, and one has been the JobKeeper package, and that has enabled employers who've seen big drops in their revenues to keep their staff employed. They've received a payment of $1,500 per fortnight, a flat payment for every staff member that they've kept on. And we've also seen a significant uptick in the amount of money paid to unemployed people. So people who've lost their jobs are now on roughly twice what they would have received if they'd become unemployed prior to COVID hitting. Now, these schemes are due to end in September, but they are currently, there was always the announcement that these would be reviewed halfway through, and we are coming up to that in July. So it's going to be interesting to see what the government chooses to do. And I think the third thing that has also helped Australians to cope with this and the Australian economy to keep rolling has been, there's been significant packages going into particular sectors, and those payments have also managed to, hold up those industries. So on the travel side of things, we're all sitting here hoping that the Pacific bubble, as they call it, is going to open. And if we can get the Melbourne outbreaks under control, we are all hoping that we'll be able to get on a plane and fly to either one of the islands or to New Zealand quite soon. And there's also talks about potentially Singapore opening up. And then I also saw this morning it was announced that the EU has included Australia in its bubble. So we can go there, but at the moment, I think still any Europeans seeking to come here would have to be Australians, and they'd also have to quarantine for 14 days. Anyway, I think we're very interested in hearing from all of you, hearing about what's happening in Brazil and answering your questions. Thank you.
Thank you so much, Professor Leach. And some of the questions that have just arrived from our audience are exactly about that. About when do you believe that our borders will open again? And if we should create travel bubbles with other countries that have well controlled the pandemic?
Look, I'm a huge fan of travel bubbles. I think that if we hadn't had this recent outbreak in Melbourne, we would be moving quite rapidly towards that. I was poised to book a few tickets myself when all of a sudden the Melbourne numbers started rolling. So we're all a bit devastated. I would have put money on early September. I'm not so sure now. I don't know what your feeling is there, Mark.
Look, I think you're right. As to the broader question of when Australia's international border will open, I think we're potentially talking even longer than that. We may be talking this time next year. That's certainly been one of the predictions of the CEO of Qantas, Australia's flag carrier airline. He said that he doesn't expect Qantas to be flying internationally until around this time next year. Whether that's the case or not, I guess that remains to be seen. It's a pretty dire interpretation. It is, as everyone knows, really all about the trajectory of attempts to control this virus, either to find a cure or to find a treatment that is substantial enough to really mitigate against its severity. As for the travel bubble idea, I mean, it's an absolutely terrific idea, but Australia, I think, is going to struggle to convince other countries that it's safe to do so when it can't even convince state governments within Australia that it is safe to do so. That is actually a problem at the moment. We've got all of the states appear to be now moving to an opening up of their state borders around the 10th of July. That appears to be a date that they've agreed on or that they've settled on, but that excludes Victoria, and there are all kinds of problems associated with that. And I think what that shows, as much as anything else, is that this is a highly fluid situation, and there's a great possibility, really. I say great in the sense of large possibility that we could see outbreaks in other jurisdictions anyway. So any of these things are going to really shake confidence that it is safe to be releasing restrictions. And as I was saying before, I think governments are of the view that you're better off staying with restrictions longer than releasing them and then having to go through the very difficult process, should you be forced into it, of trying to reimpose them, because the political support for that, and therefore the health observance of those restrictions may be more and more difficult as this goes on.
You mentioned before, Mark, the psychological side, that people were feeling like the emergency wasn't there anymore and were starting to relax. But is that really just an impression? It's just what people are feeling, because the virus is out there still. So how could people try to balance that?
It's a really difficult one because we've actually seen this before. This is a kind of what you might call an Australian exceptionalism, which is associated perhaps with being so far away and being an island and perhaps our high standard of living. But I saw this graphically. It was less associated with health, of course, but I saw it quite graphically in the global financial crisis, or the Great Recession, as it's often known in the Northern Hemisphere, back in 2008, 8-9, because Australia took very decisive sort of prophylactic action, you might say, in terms of propping up the economy, protecting it from what was going on around the world. And Australia was one of the few nations to actually avoid going into recession at that time. The political dividend for the government that did that was zero. In fact, it became a negative because the opposition at the time, which is now the party in government, was able to criticise the Labor government back then for having shoveled so much money into the economy to keep activity going, to protect jobs and demand in the economy, and therefore it plunged the budget into deficit over a number of years. So the opposition was able to argue that all of that money had been wasted. Now, that was, anyone who looked at it closely could see that was ridiculous, that argument. But the sense in the public was that there had been no crisis. There had been no crisis because they hadn't experienced a crisis, and they hadn't experienced a crisis because very imaginative government policy steered the country around that. That and the fact that the Chinese economy kept growing and Australia's economy is quite closely linked to that. But between those two things, Australia survived it. And I think there's a similar kind of psychology happening here, almost visible already, and that is that as bad as it looks overseas, and I was listening to Dr. Fauci, the chief medical officer, or whatever his official title is in the US, on Current Affairs Radio this morning, and he was making the point that they're experiencing 40,000 new infections a day, and he wouldn't be surprised to see that number go to 100,000 a day in the near future, and that this situation is well out of control. Now, as bad as those sorts of numbers are around the world, Australia feels like it has already passed the test. Now, we know that's wrong. We know that there could be outbreaks. We know that there could be a second wave. We know that when people are too relaxed, they stop observing social distancing. They start doing things that are, the perfect conditions for the transferring of this virus, and that could lead to a whole nother disaster. But there's a mood, I think, in this country at the moment that we've already won, and officials are really struggling to I think, put together the oil and water propositions that we want to get the economy going, but the crisis hasn't passed. Those two things don't appear to go together well, and I think that is going to be a real challenge for the government to try and keep, get the economy growing again at the same time as keeping people very, very alert.
Thank you so much, Mark. And we've seen those second waves happening in places that were initially examples of how to handle the pandemic, like Singapore, for example.
Correct.
They were,
yeah.
Yes. And Professor Leach, if you would like to add something about that. And another question that I have for you too is, do you believe that those countries that are being more heavily affected, is that a sign of a leadership problem? Is it, are we seeing a global leadership crisis, and it ends with this inability of containing the pandemic? Or is it because some countries are just unlucky?
Well, I mean, it is a combination of luck and leadership, but I think the leadership is the more critical element of that. When you've had a political climate, and I think the US President Trump exemplifies this most strongly, where you've been elected on a very, very divisive platform. In other words, you have played the politics of division. and you have encouraged a very divisive climate in your nation, then you are opening yourself up in a time of national crisis when you actually need everybody to pull together for that to actually, you know, fall over and actually damage whatever it is you're trying to achieve. New Zealand is one of the standout countries, both in terms of leadership and cohesiveness. But it's a very tiny country, and it's an island nation. It's 5 million people in the whole country. But the Prime Minister, Jacinda Ardern, has always played the politics of cohesiveness. And she stands up and says, we are the team of 5 million. We are all in this together. And in fact, the leader of the major opposition party there, Simon Bridges, actually was rolled by his party because he tried to play the division card because he decided that there was an election coming up and he needed to be on the attack against Jacinda Ardern. And his own party rolled him for that because they saw that this was not playing to the electorate. They saw that their best chance was to be seen as fantastic team players, but actually better at leading the team than Jacinda, rather than trying to pull down the team. In countries where those politics of cohesion are not playing out, we're actually seeing the consequences, and those consequences are dead people. They're people who are, you know, lining up behind their leaders, and the next thing they're finding themselves with the virus, and we're seeing that spread in the communities, and unfortunately we're seeing vulnerable, particularly elderly people, losing their lives as a result.
Can I just add to that, because I think those are excellent observations, and I agree with Professor Leach's point, particularly about leadership being so important. It is true of the United States that Donald Trump has ran on a divisive ticket, and he has attempted to govern on a decisive model for his entire time. He was at that Tulsa rally just a week or so ago, talking about all the very, very bad people outside. These are people that are opposed to him, which he characterizes as very, very bad. And I think that's astounding when you think about it from the point of view of a president talking about people for whom, you know, these are Americans he's talking about. These are people that he is the president of, and he's attacking their very character, their very validity as citizens, and there's a lot of them. I think the point to make broadly about people like Trump, and it would be the case for Bolsonaro as well, and that is that populists, and this is a point that Gideon Ruckman has made in the Financial Times in the last couple of days, populists do not like being unpopular, and that is why I think this virus is undoing those leaders quite significantly, because they do not do policy well, they do a whole lot of posturing very well. And that's how they've got to where they've got. And they tell people glib, easy solutions to things. But faced with a genuine crisis that brooks no such political manoeuvring, it actually requires proper, full-throated policy and acting on behalf of the entire nation, and doing so peremptorily, doing it as early as possible and as decisively as possible. I think those populists are being very quickly exposed, and the price, as Shirley mentions, regrettably in the short term is being paid by huge outbreaks of infection and a massive death toll.
Mm-hmm. That is definitely the case, and I would like to ask as well, besides all the terrible death toll and also the possible political death of these people, taking this positioning of dividing the countries or putting people against people, sometimes the justification that is given is to try to save the economy. We have to keep the jobs, we have to keep the commerce open. But is it working? How will this affect the economy of those countries that are refusing to close the commerce or to close their trade?
Well, that's been one of the interesting things. The choice doesn't seem to be between closing your economy and being less affected by the virus, but hit really hard, or opening your economy and being more affected, but surviving, you know, economically. it seems that the economies are being hit regardless. So your choices are close your economy, cause, you know, quite a lot of economic damage and save people's lives, or leave your economy open and damage your economy and let people die. I mean, I guess, you know, that was where the UK started. You know, Boris Johnson was very much on the let's leave everything open. And in fact, they kept their borders open for an astonishingly long period of time, even as the death toll was surging.
Even long after the Prime Minister himself had had a near-death experience from it. That's
right. So, I mean, that turned out that idea that you could just, you know, ride it out has not, and the economy would continue to prosper, has not turned out to be the case. And I think part of the reason for that is that people actually have been voting with their bodies. People don't actually want to get sick. They don't want to die. They don't want their parents to die. And so even if a government hasn't locked down, there's been an awful lot of people who've just decided to stay home.
That's a really excellent point. And Britain's a really good example of that, because the policymakers in Britain, this has come out since they've had to change direction, but policymakers in Britain, in the Prime Minister's office, and even the health officials around the Prime Minister, made a decision early on that was based on some fairly dubious behavioural science that they said suggested that Britons would not countenance severe social restrictions. The kinds of, you remember that the model for this, you know, the sort of gold standard, if I can put it loosely like that, of response was what the Chinese did in Wuhan and in Hubei province more broadly, and in other cities as well, including Beijing. But principally in Wuhan, they locked down very, very tightly a city of 10 million people, and they did so effectively overnight, and they policed it rigorously. Now, their death toll, at least officially, is still lower than 5,000, notwithstanding the size of their population and the fact that you know, they've had the longest time exposure to the virus of any country. And so other countries looked at that, policymakers looked at it, and in Britain, they decided, well, the English or Britons generally will just not put up with that level of direction, and so we won't even advocate it. They now realise that was a mistake, and they realise it for two reasons. One is the obvious one, the death toll and the spread of the virus, and the other, as Shirley Leach points out, is that Britons themselves became very willing participants in the social and economic lockdown for those reasons that you suggest, Shirley. I mean, they're not stupid, and they could see that the health advice was to separate and to protect yourself and observe all of the personal hygiene measures that you possibly could, and to do so for as long as is necessary to avoid becoming critically ill and having members of your family and possibly yourself die.
Exactly. And if any of the alumni that are participating of the session today would like to share their experiences and what they are going through in Brazil, please just send a private message to our panelists via the chat, and we can unmute your microphone. You can also send your questions through the Q&A. Another question that we got here, I thought it was interesting when you were talking about the position of the English people. When we talk about an entire country, sometimes it's a bit difficult to predict how people are going to react, and especially in areas where it's the concept, for example, of Australians is actually so multicultural, and people have so many different ways of thinking and reacting to things. We have one of our guests here that said how multicultural media has played a crucial role in combating COVID-19 by translating information to more than 60 languages. And then that helped to finish some myths and misconceptions in relation to COVID-19. What do you believe that local governments and civil society can do to further support multicultural communities?
But that's a really good point, because, I mean, again, one of the characteristics of the outbreak we saw in Melbourne was the fact that it is an incredibly diverse, multicultural community. And it turned out that, in fact, they had not been particularly good at getting COVID-19 messages out there in multiple languages. And so a lot of those communities were just simply not receiving the information in ways that they could understand it, particularly a lot of older people. We tend to find in immigrant communities which speak multiple languages, that whereas the younger people are out in the workforce and the schools and they tend to pick up whatever the language is here, it's English obviously, older people often never really pick up the language and become very isolated. So those people who were most in need of the messages were least likely to be able to consume them in the way that they were circulating most. I think that that has been a late realisation on the part of local governments here in Australia, and we're now seeing a big push, lots and lots of door knocking by people, who speak multiple languages, the spreading of information in multiple languages and so forth. But I think it's absolutely critical. You've got to make sure that people not just are getting consistent and clear messages, but they're actually able to understand them because they're in the right language and actually couched in the right kind of culturally appropriate terms for those communities.
Thank you so much, Professor. And because we were talking before about the trips that you wanted to do and that unfortunately won't happen, we have a question here. How affordable do you believe it will become to fly internationally? Or will it actually get more expensive?
It could go both ways, couldn't it, Mark? I mean, obviously all of the airlines are going to be desperate to get people back on board, and if it's too expensive, who can afford to fly? But on the other hand, they're absolutely going to have additional costs for some time to come, and they're going to want to recoup that. I don't know what your thinking is there, Mark.
Look, I think that's right. I think Australians are particularly intrepid, and I think once it's become clear in their minds that air travel is safe and the authorities have allowed it and the airlines are saying it and the health authorities are giving sufficient support to that as a proposition, I think there'll be a fair bit of pent-up demand in the market for overseas holidays. Perhaps there'll be different destinations than have been in the past. There might be fewer people travelling for holidays in China or some of the really very packed, very tightly populated Asian cities. I'm not sure. I'm just making a guess there. People may be travelling to other locations. But I think there'll be a fair bit of pent-up demand. And I do think that airlines will be they'll do well to capitalise on that, but there'll also be a fair bit of competition for airlines. I expect Australians will be more inclined to use Qantas, which is a very trusted brand for international travel. Of course, that means Qantas has to be flying, and Qantas is going to want to capitalise on that a lot. But I think probably the short answer is it's going to become, in the long term, more expensive. That would be my guess. Partly because airlines are going to be fewer in number, and they're going to be smaller operations, and I think there'll be that they're just going to have a slightly different pricing model. They'll be more expensive, and that's just the way it's going to be.
Yeah, I mean, I don't know if you've caught up with the fact that the two main airlines here, Virgin and Qantas. Virgin went very quickly into receivership and has now been bought by a major private equity company. So we're going to see far fewer flights out of Virgin for some time to come. So the number of flights has gone down, pent-up demand. I think in the short term, at least, we're going to see price increases because that's just how airline seat pricing works. It's just formulaic.
That's right. And there's going to be a fair bit of cost recovery for a whole period of not having earned a dime whilst carrying a lot of costs.
Yeah, so that's not good news, unfortunately, for us anyway.
Very well calculated, because at the same time, not all the people that could afford traveling before can afford it now, because a lot of the public is dealing with loss of jobs or loss of income as well. So they'll have to fine tune it very well. That's
absolutely right. And the other thing is that, the kind of bottom of the market budget airline where most of us are off for our holidays here. I mean, Australians love going to places like Bali on cheap flights. You know, how much appetite is there really going to be for being packed in like sardines in those seats that seem to get closer together and smaller every year for some time, because I think those memories of COVID are going to linger for some years.
Yeah, there will definitely be some changes on the way that we travel and how we think about our holidays. We do have an interesting question here. Do you believe that the comprehensive approach to biosecurity adopted in Australia has helped on the response to COVID-19?
Well, it has and it hasn't. Strangely enough, you know, I talked in my opening remarks about some decisions that were taken and some that were missed or that came a bit late. One of them was that we were not doing screening for temperature and other symptoms at our international airports for many, many weeks into this crisis after it became clear that should be going on. And a number of returning overseas travellers, I mean, initially they were just asked if they had any symptoms. And if they said no, then that was that. And there was a fair bit of pressure coming via questions from pesky journalists, but also from some health authorities, wondering why it was that Australia took so long to start doing temperature checks and the like, and then eventually, obviously, to close the borders. I think the critical border closure really was the early one with China, but the overall border closure took a lot longer. And some of those tests for air travellers took a long time to happen. And for people coming in, as I also mentioned in my remarks, for people coming in on cruise ships, well, it turned out there weren't any, which is why we had this ridiculous situation of 2,500 people just being disgorged literally into the heart of Sydney at the peak of an epidemic, with some of them immediately testing positive or showing symptoms of COVID, and it turning out that you know, vast number of them were actually carrying the infection. So it's been pretty patchy. Australia's always regarded itself as having very good biosecurity laws, or rules, but it didn't. They weren't properly applied, and they weren't properly beefed up at the time. And a government which has made so much political capital out of running a very strict border policy. Indeed, the Prime Minister is the former immigration minister who famously stopped the boats, and he even has a trophy in his office saying, "I stopped these," with a silhouette of what appears to be an Indonesian fishing vessel on it. And the point about that was the government, this coalition government, ran a whole political policy based around the idea of stopping asylum seekers from being able to reach Australia by boat. But when an actual threat hoved into view in the form of the Ruby Princess, an enormous cruise ship with a whole lot of people sick on it, no one stopped that boat.
Yeah, and I think the point to make there is that we've had these two policies. One, biosecurity, was actually aimed at protecting our agricultural sector. It wasn't aimed at protecting the health of Australians particularly. That was a real minor consideration. So it was focused on, you know, don't bring in fruit and vegetables, don't bring in meat, not don't bring in illnesses. And on the other hand, it was, we had, in terms of the human factor, it was isolating potential, you know, refugees and people trying to get in to Australia illegally. It was never about illness. So we actually were very, very ill prepared, and I think it's taken Australia quite some time. Again, we were lucky because of our relative isolation. We were actually given a little bit of time to catch up. But about a third of all of the deaths from COVID in Australia have come from that one ship, from the Ruby Princess. So it just goes to show how critical those measures actually have been, those border control measures have been.
And how much luckier, how much better we could have been had that not happened. Our infection rate would be significantly lower. Yeah, so it has been it has been a story of considerable luck, really, for Australia. And can I just take up one other point? I know it wasn't actually in the question, but another point that Shirley raised there about being ill-prepared. I think it's interesting to note that we talk about preparation all the time in the defence space. You know, Australia is in the process of spending $200 billion over the lifetime of its future submarine acquisitions, $80 billion to build these submarines, and a $200 billion package over a longer period for their operation and maintenance. That is in respect of a threat that may or may not emerge, and for which those submarines may or may not be relevant and may or may not have any significant deterrent effect even before then. And yet we'd long been, everyone around the world had long been advised of the threat of pathogens such as a pandemic bug that could sweep through the world. And we were really rather ill prepared. I think this is probably true to say for many countries. But Australia was even short on surgical masks. It had lost its capacity really to make ventilators. So there was no Australian local capacity for the manufacture of ventilators. This has been part of an economic hollowing out of Australia's economy over a period of time, to be too reliant on income from resources and on the delivery of services. Education, higher education, for example, is Australia's third largest export. So it's a very significant and successful sector. It's also one that's been plunged into crisis as a result of the close down, the closing of borders and the ending of international students coming here and so forth. But that preparedness for what was a long warned about pandemic threat turned out to be pretty low. And again, it's just another way in which this country has been really lucky to get away with it.
Would you have any suggestions of how much budget or which areas the government should be putting money into to prepare for a possible next pandemic? Because those things probably will happen again eventually.
Look, I don't think either Mark or I should really comment on that. I think that is, again, something that you actually need a group of experts, medical experts, to help you to prepare. But also, I think what has really come out is that we actually need to have more exercises as nations, as cities, as states, what are we going to do if and when the next pandemic strikes? Unfortunately, I've been reading, I don't know if any of you are familiar with Hilary Mantel, the novelist. I've been reading the latest in her trilogy, The Mirror and the Light, which is all about what happens in England following the death of Anne Boleyn. And one of the things that is a constant theme in the background is rolling plagues. Every year, and the plague rolls into London and the court flees. So in other words, these are societies that have actually learned to accommodate themselves and to change the practices of their governments, even where their leader is located, based on waves of pandemic. And I think we as societies are going to have to think about how we're going to accommodate this in the future, because there is no doubt that there will be another pandemic at some point.
Yeah, and I think what we need to see is a rebalancing of the notion of risk. We need to actually accept that this is a clear and present danger, a tangible risk that could emerge at any time. I think the last such exercise in respect of a pandemic was back in 2008. That's a long time ago, and it's almost as if we decided through a lack of urgency that this matter was resolved. We're having a big announcement here in Australia today on the acquisition of a whole lot of missiles. So we very much understand the future, or try to understand the future defence or strategic environment, but the health and security of a nation, the survival of a population, is also threatened by these sorts of events, as well as we're having graphically exposed to us at the moment. And I think governments need to do a lot more in addressing that.
And what is the role that education has in preventing situations like this? One of our guests is asking that Australians being a high educated society, has it helped in better understanding the risks of COVID-19 and avoiding a worse situation?
I would say yes. I mean, I've literally just say yes. I think it has helped. I think there have been, as Shirley was saying before, I think there have been some difficulties across cultural barriers, language barriers, for example. And there are the areas in Melbourne that we've been talking about that are facing this localised outbreak at the moment do tend to be lower socioeconomic status areas where probably there is a lower mean level of educational attainment and literacy, particularly English literacy. So you could say as a general observation that supports the thesis that the more educated people are, the more likely, certainly educated in English, the more likely they are to be absorbing these messages. But I do think that a generally high level of education in Australia makes a pivot in policy and the communication of new requirements on the population, new behaviour, makes it easier to do than if people are unable to read and write and to assimilate what sometimes are difficult concepts, but for a longer term good.
Yeah, I totally agree with that, obviously. And in addition, I think one of the things that it really highlights is the critical importance of educating people about information and educating people about the internet, because as I mentioned earlier, one of the terrible things that has been happening during the pandemic is the circulation of fake information about the virus. Things like the 5G cell phone network spreads the virus. I mean, if you've got any basic scientific education, you'd know that that's actually impossible and ridiculous. But nonetheless, it has gained currency in some communities. The ridiculous notion that vaccinations can lead to mind control, or that people like Bill Gates are pushing some sort of evil world government through vaccination programs. I mean, these are the sorts of things that are picked up by people who are poorly educated, have little scientific knowledge, but also have very little understanding of the fact, very little critical engagement with the information that they do receive, particularly through these kinds of conspiracy websites. So our best weapon against this kind of stupidity, which is so dangerous, particularly to the people who are taking it on and putting themselves in danger as a result, is education. So yes, education. It is the answer to many things.
Indeed, and higher education in particular, the teaching of critical thinking. This is something that the Australian government needs to remember, because it's not, there have been a lot of successful interventions in the economy as a result of this COVID crisis. As Shirley mentioned, the government has the direct wage subsidy JobKeeper program, $70 billion over 6 months. There's the doubled unemployment benefit, which is now at about $78 a day instead of $40 a day where it was. Both of those cut out at the end of September, so we're not sure what comes from that. But those sorts of assistances, particularly JobKeeper, has been excluded from the university sector, a university sector that's already been hammered by the loss of international students. And it's hard not to see some of that as being driven by a view on the conservative side of politics that the university sector is somehow hostile to it. It's part of a general antipathy that exists between the conservative side of politics and the academy. And if it is ideological, that's very regrettable, because critical thinking is ultimately the greatest thing that comes out of education, and higher education in particular.
Another question we got from our attendees is how COVID will change Australia's foreign affairs and international cooperation. We had this similar question posed yesterday to the Ambassador of Australia in Brazil, Ambassador Tim Kaine, and we would like to hear from you. What do you think will be the biggest impacts over foreign affairs and cooperation?
Oh, that's a big one.
I would have liked to have heard what Tim said
Yeah.
about that, to be honest. But I would say this: the Australian government, I think, a bit unwisely, the Prime Minister, when he was in the US last year, and even more unwisely, I think, attended what effectively turned out to be a sort of a political rally with President Trump, which I don't think was ideal. But when the Prime Minister was on US soil, he did raise this idea of negative globalism, which seemed to be playing into the Trump view of the world, which is about isolationism, about pulling out of multilateral bodies, and going it alone, and being more kind of isolationist. Since then, the foreign minister, who technically is Tim's the ambassador's boss, has I think put a more sophisticated, more corrective message out there, and talked about strengthening Australia's involvement in multilateral organisations. And I think that's a much more constructive way to go. I like to think that the foreign minister's more considered comments in a landmark speech, which I think actually was made here at ANU, now that I recall, is a reflection of Australia's understanding that as a middle tier nation, our involvement in and maintenance of the integrity of multilateral organisations is the best thing we can do to leverage up our power in maintaining the rules-based order and in having an orderly world in both a strategic and a trade sense. So I'm not sure that that's specifically a function of COVID, but I do think there have been some mixed messages, as there has been within the COVID crisis itself. But I'm choosing to take the foreign minister as the one who's setting the more sophisticated message here.
Yeah, I think the other aspect of this is that we had a rather interesting announcement by Maurice Payne, our foreign affairs minister here, in the middle of the worst part of the crisis here, which was really asking for an investigation into China in terms of their handling of COVID-19. This wasn't done through normal diplomatic channels. It was actually announced on television, and it was a very unusual thing for a foreign affairs minister to do, and it was a very unusual approach to handling diplomatic relations. And I think it caused a huge outpouring of antipathy towards Australia from China, and the China-Australia relationship has been a little rocky since. And even when we were seeing all the announcements today about the new defence spending, it seemed very pointed in terms of what was the threat that we were protecting ourselves from. So we are seeing a growth in those tensions, a very bizarre situation where we are, China is Australia's largest trading partner. There is no doubt that the growth of trade with China after the global financial crisis has really led to that wonderfully buoyant Australian economy. China has really benefited Australia economically. So usually you cozy up to your biggest trading partner, but we're doing the exact opposite. So we're in for an interesting time here, I think, in Australia.
I heard the Greens leader, which is the sort of very, very much a minor party in the Australian political sense, only has one seat in the lower house where the government is formed. But the leader of that party said today, and I think it was unsurprising coming from him, but nonetheless a fairly economical description of the problem, or economic description of the problem. He said Australia has got itself too close to China in an economic sense, and too close to the US in a political sense. And I think that pretty much encapsulates the problem, because these two are not close to each other at all. They are the two big lodestars of power and friction in the world at the moment. And Australia, it's long been recognised, sits awkwardly between the two as a result of that trading relationship and that long-term strategic reliance. And how that's going to work out is, well, it's on everyone's minds, and every decision that's being taken, every announcement that's being made is always viewed through the lens of that dilemma. And as Shirley points out, that decision to call for an inquiry into the outbreak in Wuhan, how it came about and what was done and so forth, I think it's really important to make this point, and I'm sure Shirley would agree with this. Yes, the world needs to know exactly how the virus came about. Yes, the world needs to know everything that can be gathered about the management of it, and whether there was a delay in going public and whether that had any impact on how the pathogen moved around the world. All of that is absolutely true. Did Australia need to support it? Yes. Did Australia need to front run on it? Did it need to publicly call for it, or did it need to do so, offer its support in another way? That's the question. And I think, you know, a lot of people, when that debate happens in Australia, if you say that, they instantly see you as someone who's what's described as a panda hugger, you know, someone who wants to kowtow to China. But it's not about that. It's just about diplomacy. Diplomacy is always about the way you frame messages, the way you look after your national interests. And I think the US would have been over the moon with the fact that the Morrison government was so public in its call for this inquiry. But when you think about it, why, of all nations in the world, should it be Australia that leads that charge? I mean, we probably have done better than almost every other nation in the world, and yet we also have a very close trading relationship, probably one of the most dependent trading relationships of any country in the world. So it is hard to see why we would be so public about the way we went about it. Why not do the background work first and perhaps support the inquiry, but let the EU take the running or someone else?
Exactly, exactly.
Thank you so much, Professor Leach, Professor Kenny. I would like to finalize this one question here. We are almost at the end of our webinar, but what could Brazil learn with the way that Australia is dealing with COVID-19? And if you could highlight one positive lesson and one negative lesson that Brazil could learn from Australia.
Oh, I think the positive lesson is that community cohesiveness is the #1 weapon against things like pandemics and, in fact, any kind of national crisis. And you can't just manufacture community cohesiveness. You actually have to lead with that as your main, I guess, cultural message to your communities. So divided communities are going to suffer more, particularly in times of crisis. Mark, I don't know what you'd...
Well, I agree with that. I think it's an excellent point. The other one is, obviously, when you get sick, this is a lesson, when you get sick, listen to the doctor. She knows best. And that turns out to be true of governments as well. And this is what... you know, we see this point being made about climate change as well. And there's no surprise that these populists around the world, these right-wing populists, are antagonistic to listening to scientists on climate change. They were also highly skeptical about listening to their health officials in the as this viral threat hoved into view. I think the lesson is experts are important, education is important, people who are trained epidemiologists and biosecurity experts and clinicians. These people have developed a level of expertise, and governments should listen to that expertise and inform policy that way. And as Shirley says, if your whole approach to politics is division, then you're going to see everything in those partisan terms. Every issue that comes up, you look at it in terms of what it advantages or disadvantages your political side. And that is the wrong way for government leaders to operate. Government leaders need to operate for the country that they lead, and the ones that haven't have been the spectacular standout failures in this process.
Thank you so much, professors. I would like to invite my colleague Daniel Brown just to say a few words. Daniel Brown is from the International Strategy and Partnerships division of the ANU, and he has been here in the background helping with some questions, and he's been with us the entire series helping. Hello, Danny.
Good morning. Thank you so much, Anna Paula. Fabulous job once again on the moderation. And a special thanks to Professors Mark Kenny and Shirley Leach for giving up some of your valuable time today. It's been a really, really interesting insight. And this is coming from a person who is from Australia and has been watching the news every single day. It must be especially interesting to our friends and alumni who are watching all the way from Brazil. So I just wanted to thank everybody for your participation. Thank you to the alumni who are in the audience asking those really insightful questions. And for those of you who are interested, we will be running another seminar Friday morning, Australia time, and Thursday night in Brazil. And this is going to be a really fascinating seminar on women in leadership, and it's got a special Asia Pacific perspective. So if you are interested in this, please join us on Thursday night in Brazil or Friday morning in Australia. Thank you, Anna Paula.
Thank you so much, Daniel. Thanks again, Professor Leach, Professor Kenny. Thanks to our attendees today, and we'll see you again for the last webinar of this series organized by the Embassy of Australia in Brazil and the Australian National University. We'll see you on Thursday night. Boa noite a todos e muito obrigada. Até quinta-feira. Tchau, tchau.
Ciao, ciao. Thank you.
Bye.